Well, welcome everyone. Please drop your name and where you are joining from in the chat box. So this webinar series draws on a one-year collaboration at the New Institute in Hamburg, Germany, that involved 8 scholars and practitioners who developed public policy recommendations and policy pathways to confront power inequities that prevent transformations on food systems, including different topics: agroecology, fisheries, seeds, affordable diets, governance, and others. The series covers these 8 topics as listed in this slide. And we all know, if we are working on food systems, we know that power inequities shape the policies, the options, and actually shape what we have in our plates, in our tables. This session is particularly focused on nutrition and power, particularly on how to overcome the power inequities so that healthy diets are affordable and accessible. Healthy diets, and we all know this, remain out of reach for billions of people, and making them affordable must move to the center of the political and the technical agendas. And this is why we're here. This series is hosted by Food and Planet and also the Food and Social Justice Action Research Lab in the Food Studies at the New School and the New Institute. In this session in particular, we are glad to have as co-hosts Alliance and the Alliance of Biodiversity International and SEAT and Oxfam. Both organizations are doing a critical work on agrobiodiversity, nutrition, and equitable food systems. This session is the second of 8. You'll see in that flyer the other sessions that are coming up in the next few weeks. Special thanks to the event staff at the Lang College and the New School for Social Research, the IT staff at the New School, and Cedric Gottfried, PhD candidate in public and urban policy at the New School, for their help running this series. So we have a great panel today. Our presenter is Chris Bogliano. Chris is the co-founder of Food and Planet. He's a postdoc at Wageningen University and co-author of the report featured in this series, The Elephant at the Table. Our commentators today are Martina Hoover, advisor on agrobiodiversity and nutrition with Oxfam, and Gina Kennedy, principal scientist with the Alliance of Biodiversity and SEAT. Thank you all for joining today. Please feel free to drop your questions in the Q&A box, and we will do our best to address them after the presentations and comments from the speaker and panelists. And now I'll hand it over to Chris. Thank you.
Great. Thank you so much, Jose Luis, and welcome everyone. Thanks for joining today. As Jose Luis mentioned, I'm Dr. Chris Voliano, a co-author of the Elephant at the Table policy report, and I'm honored to be here with you all today. I am a registered dietitian by training and have worked in food systems for quite some time, but I just want to give a nod to the opportunity that this fellowship at the New Institute under Jose Luis's direction really afforded me and the other fellows with the opportunity to dive deep into how power is shaping our food systems for better or worse. And with this chapter that I wrote on nutrition and power, I was trying to answer the simple question of why can't billions afford a healthy diet? And frankly, the answer isn't a lack of nutrition knowledge or even personal willpower. It's about who controls what gets grown, processed, subsidized, and what gets marketed. So I'll be making the case today that this diet challenge is actually structural, not individual. And we will be walking through some concrete policy levers for changing this. And so the overview of today's short presentation, followed by the expert panelists' reflections and discussions on what they're doing on their own work, is first we're going to start with the problem, why healthy diets remain unaffordable. We'll look at the power analysis of who's controlling the levers currently, a vision for what more equitable food systems might look like, and some key policy recommendations and strategies for transformational systems change. So part one, the diagnosis. Why are healthy diets out of reach? Well, Frankly, access to healthy, affordable diets is a fundamental human right that the vast majority of countries agree on. Yet, amid the mounting nutrition-related chronic diseases, the widening wealth and health inequities, and escalating environmental pressures, this right remains out of reach for billions of people today. Healthy and sustainable diets are defined by the FAO and WHO as those that promote health, prevent all forms of malnutrition and non-communicable diseases. They minimize environmental impacts, preserve biodiversity, support cultural traditions, and by emphasizing a variety of minimally processed foods that are accessible and affordable. And right now, the work from Herforth and her team creating the Healthy Diet Basket found that a healthy diet costs a minimum of $3.68 per person per day. And this is a stat that shows that a healthy diet is out of reach for the wages current folks are making around the world. So even when these nutrient-rich foods are even present physically in the markets around certain populations, the low earnings, climate shocks, and price volatilities keep them inaccessible for those who need them most. And so without policies that raise incomes, address poverty, or reduce structural inequities, strictly supply side improvements alone won't meaningfully close this gap. I also want to touch on the Green Revolution's legacy. I'm sure many of you on the call are familiar with the Green Revolution. It was an industrial agricultural initiative to increase yields and calories, and frankly, it did that very well. However, in that process, it dramatically narrowed crop diversity and degraded ecosystems. And now, today in 2026, over half of global calories come from just three crops: rice, corn, and wheat. And this is not resilient from a nutrition, a climate, or cultural standpoint. In addition to that, these high yielding varieties are actually significantly lower in micronutrients than, say, more traditional foods like legumes or leafy green vegetables and other underutilized species. Emerging evidence is actually showing that rising CO2 levels in our changing climate is actually continuing to reduce the micronutrient content of many of these staple crops. So looking forward in the next 10, 20 years, we will be getting less nutrition out of the current crops that we're growing. And so the result is that food systems are generating an abundant supply of cheap calories, and these calories are often displacing locally adapted foods that once supported more resilient diets. I also want to touch on corporate-driven dietary shifts. It's clear, I'm sure to many of you on the call, that corporate interests are using really heavy marketing and lobbying policy influence to make ultra-processed foods artificially cheap. They don't take into account the true cost accounting. In addition to that, trade structures are also reinforcing this homogeneity, crowding out fruits and vegetables, and as I mentioned, other traditional crops. Having spent time in many areas of the world, you see that the rapid expansion of ultra-processed foods, particularly in lower income economies, is growing rapidly. In addition to that, IPs such as seed companies are limiting farmers' ability to save and adapt seeds, also reducing crop diversity. And so these multiple forces are creating what researchers call the global syndemic, which is the experience of undernutrition, obesity, and climate change, all reinforcing each other to reduce the accessibility of healthy diets. And so part two of this, I want to talk about the power analysis. Why are food systems currently failing us? And for one, the colonial legacies are still with us today. That it may seem like something in the past, but there are new forms of neocolonialism. I'll talk about a few of those in the next slide. But colonial rule has traditionally prioritized export crops in the global north, displacing those local food systems. And in addition to that, these industrial food systems and the marketing, also youth migration away from maybe their rural hometowns to an urban setting, have weakened that intergenerational transfer of traditional food knowledge, breaking those linkages that have existed for centuries. Also, some dietary guidelines, many in the global south, are still modeled after Western diets, often neglecting traditional foodways. Though I will add that many countries, some countries around the world are actually integrating more traditional ecological knowledge, and we'll discuss those in a moment too. But one example is in the Pacific Islands, where trade liberalization started flooding the markets with cheap imported rice, sugar, oils, and wheat, which crowded out the incredible biodiversity that has previously existed there in those nutrient-rich staples, which reshaped diets even within a generation. Another example of this is in Southern Africa, or you can choose many countries actually. This supermarket expansion in cities has marginalized informal food vendors, which are a critical source of affordable, biodiverse foods, and that displaces those foods, concentrating the power in retail chains in formal markets. In addition to that, only a handful of corporations and transnational corporations control the seeds, inputs, processing, trade, and retail. And this graph here is really profound. It shows that 12 companies together own over 550 of the most common consumer brands that we likely see when we walk into a supermarket. I also just want to mention on the research side that industry-funded research was nearly 4 times more likely to produce favorable findings. So there's this science avenue that industry is taking to kind of skew science in their favor, something to watch out for. Also, kind of in the same line, health washing and nutritionism allows ultra-processed foods to be marketed as healthy. One example is like Milo drinks. It always gets me when you see like this. Basically, it's a sugary chocolate beverage that's fortified with nutrients, and there's a kid playing soccer on the front cover, or it could be Milo ice cream, and there's a kid playing soccer. And it just always baffles me that this nutritionism, yes, it might be high in vitamin D and calcium, but it ultimately is sugar at the end of the day. So that health washing is a very big concern as well. And frankly, public subsidies are overwhelmingly favoring commodity crops, industrial livestock systems, which hide the true costs of environmental degradation and diet-related diseases. And I also want to mention a few other power disruptions in our food system, such as food aid. I previously worked at USAID, RIP, and there is so much good work happening there. But when you have Title II commodities such as fortified corn or soy, not only in the context of conflict zones, which is necessary, but when you're in those transition periods and still relying on those Title II commodities, it interrupts the cultivation of local traditional foods and disrupts those local markets, creating a reliance on these imported Title II commodities. In addition, biotech solutions, and this is not anti-biotech, but when we look at a single silver bullet solution such as golden rice, it can divert attention and resources away from approaches that we know are effective, such as agroecology. And lastly, I wanted to mention convenience, which is a structural barrier. Urbanization, time poverty, and lack of access to kitchens and skills are pushing households towards the more highly processed, ultra-processed foods. And the response here could be more ready-to-eat healthy options, but rather not telling people to cook more, because oftentimes we don't have the time, especially in really urban settings. It can be quite challenging. And I also really, this is an important point, is the marginalization of women and indigenous peoples and marginalized groups are often excluded from food system decision-making. Women provide a substantial share of agricultural labor, yet they are less likely to control the land and the services required to make these high-level decisions. And lastly, the traditional ecological knowledge, or TEK, is constrained by colonial government structures, and non-Indigenous institutions often do not retain, or non-Indigenous institutions retain authority over many of these materials. And so this is really about equity: who is included from making decisions and in what gets grown, subsidized, or eaten. And so I want to shift now towards a vision of a better, more equitable and just food system, and some policy recommendations that we can use to get there. And so a vision for the future, this is one of a short section of the chapter we wrote, and it really, it's like, how do we really see the future of an equitable food system? And the first and most important point to me is affordable, nutritious, and culturally relevant foods should be recognized globally as a human right. Also, environmental sustainability and agricultural practices should be central to food system design, moving away from this resource extractive monoculture system. Subsidies decisively supporting nutrient-rich, locally grown foods over ultra-processed foods. I know here in the United States, I think it's only 2% of all of our subsidies go to fruits and vegetables, while the other 98% go to commodity crops and for livestock and ultra-processed foods. So there's a huge gap there and a real opportunity to shift some of that money. Also, just supporting community-led councils guiding policy with equal representation. And I have an example of that in a later slide. Having traditional ecological knowledge helps shape dietary guidelines alongside scientific evidence, and ensuring corporate accountability, prioritizing nutrition and sustainability over profit. I'm really looking at that triple bottom line rather than just profit. And so now I'm going to shift to the recommendations. There are 4 pillars that emerged during my literature review on this topic. And so I'll go through those 4 now. The first is fiscal and regulatory measures for affordable and healthy diets across 5 dimensions. And those 5 dimensions are affordability, accessibility, desirability, availability, and convenience. And so affordability, an example of that could be taxing sugary beverages or ultra-processed foods and redirecting those revenues to subsidize more healthy options. As I mentioned, reforming agricultural subsidies away from commodity crops to more nutrient-dense foods. Accessibility, setting and enforcing standards for public institutions that limit ultra-processed foods and require more culturally relevant foods, such as Brazil's school meal program. This is an excellent example. This new program mandates that 30% of ingredients for all school meals come from small-scale farmers that are locally produced, which is just incredible. Desirability, mandating front of package nutrition labeling and maybe even restricting unhealthy food advertising towards children, which we see growing in many areas. A good example of this is Chile's front of package labeling, which helped reduce purchases of high sugar products. There's evidence that this works. Availability, legislate local nutritious sourcing and public school programs, supporting regional producers year-round, building that confidence for farmers to plant these foods, knowing that they will have a consistent buyer. And convenience, investing in local processing, freezing, meal preparation, meeting folks where they're at. This is one that we often overlook because often the answer isn't just cooking more, it's investing in local processing infrastructure so that healthy, ready-to-eat options exist and compete with more ultra-processed, shelf-stable options. Pillar number 2 is guaranteeing a universal nutrition guarantee. Establishing a universal basic nutrition guarantee. This means free or subsidized healthy foods, especially for youth. Some countries are doing this, and there's an opportunity for more to step up to this, ensuring that all kids have access to diverse, healthy diets. Transforming dietary guidelines into binding policies, shaping procurement, subsidies, and production. As I mentioned, Brazil is really the model here. Their dietary guidelines are legally connected to public procurement, prioritizing those fresh, minimally processed foods. Developing regional specific guidelines. So in larger countries like Brazil, the US, China, how do we adapt these national guidelines into more regionally specific guidelines to promote more local regional biodiversity, adapt to local context, traditional knowledge, and ensure equitable access? And lastly, limiting the industry influence over dietary guidance. We've seen this in some countries here in the US, even the past 2 dietary guidelines, not even this one, have all been influenced by industry. The recommendation of the past 2 were to include sustainability, but then industry lobbying lobbied that out, saying it was out of the scope of nutritionists or dietary guidelines, which we all know is not true because everything in food systems is quite connected. Pillar 3, community-led transformation. So investing, as I mentioned, in that local processing, cold storage, distribution, and empowering more cooperatives, women groups, co-creating community food programs, building decentralized digital enabled supply chains, and there are some examples of this happening to kind of skip the middleman and connect farmers right to consumers directly. Integrating healthcare and food systems for preventative, culturally responsive care, because the evidence is very clear. Prevention costs so much less than treating diet-related chronic diseases, up to 5 times less. And so prevention is typically always cheaper than treatment. And so this is a real opportunity to save money and improve health at the same time. And lastly, equity embedded across all food system layers and actors. This pillar really is a cross-cutting pillar. It could include guaranteeing equal land access and rights for women, indigenous peoples, and marginalized groups, legally protecting indigenous seeds, lands, and food cultures, reserving seats at the table for these groups. Not to keep pulling out Brazil's example, but it is such a great case study. And I was just reading it this morning just to refresh myself. And it's quite amazing that the Brazil's Council for Food and Security of Nutrition is comprised 2/3 of civil society and only 1/3 of government members, giving people true power to make decisions for themselves and kind of moving towards that sovereignty model. And also just integrating, as I said, traditional foodways into dietary guidelines and education curricula to show that there's not one size fits all, and that healthy diets can look very different depending on the context and cultural foodways. And so the key takeaways that I would love for you guys to walk away with is that the diet crisis is not always a failure of individual choice, but rather a failure of systems. But we do have the power to redesign those systems. Healthy diets are expensive and out of reach for billions. And this gap closes with structural reform, not simply nutrition education. The 4 pillars I mentioned, the fiscal reform, universal nutrition guarantees, community-led action, and equity at the foundation is essential for food system transformation. And right now, there have been studies that show that less than 1% of current interventions are targeting systemic change. So we know the levers. I mentioned many of them in this talk, and there are many more in the policy report that we published, but they require the political will to actually enact them. And so we actually really do need to be using our voices to help shift these policies towards equity and towards justice. So I'll close with a line from my chapter's conclusion. The time for incremental change has passed. Transformative, justice-driven policy is essential to nourish both people and the planet, ensuring that every community has the opportunity to access and enjoy healthy, diverse foods now and for future generations to come. Thank you so much, and I will pass it back to Jose Luis.
Thank you so much, Chris. It's quite interesting to go through this overarching analysis of power from colonialism to how Western diets are marginalizing traditional diets and have done for decades. And also how corporate concentration and subsidies end up making unhealthy products cheaper instead of policies to make healthy products more affordable, of course. And I really like the vision of the future and the 4 pillars of systems change that directly address these power inequities that you mentioned, for example, with community-led transformation, and even considering equal land access and control. And now is the turn that we'll hear from our panelists. And first is Martina Huber, followed by Gina Kennedy. Each will share a brief 5-minute reflection connecting Chris's presentation to their own work. And as a reminder, please submit any questions into the Q&A. And Martina, over to you.
Thank you so much, Jose, for the introduction. And thanks, Chris, for your talk, where I will connect it to the work that we are doing with Oxfam. So you will hear later from Gina. So I will more look at the bottom-up approach that we are working on, especially focusing on the Global South. So what we work with is a far field school approach. Some of you might have heard, and for the others, I will just shortly introduce it. And actually, this is also why I show you this picture. Farm field school, it's defined like a school without walls. In the sense, the place doesn't matter. It really happens in the field where with this approach, the only thing what we do, we as in Oxfam or any implementing partner, is we create the space with a facilitator for farmers to gather and to do their own problem diagnostics, in the sense they come together and get a space to actually discuss about the underlying problems of what they suffer from, the symptoms of like malnutrition. Often it's not recognized where are the roots of this. So it's with tools that the facilitator gives, that people, or in that sense, the small scale farmers that we are working with, really have a common understanding of their problem and own the problem, and then together create their curriculum, since it's a school, and lay out activities over the season of how they try to tackle this issue. And this is all based actually on local resources, a lot of local knowledge and a lot of local seeds that maybe some of the members still have saved at home but don't use it, or is somewhere around forgotten, but then can be brought back. So this is in a nutshell. And one of these tools is what we see here on the picture. It's called the diversity wheel, where essentially you have four corners. With one is where you look at what do many farmers grow in a large area, what do many farmers grow in small areas, what do few farmers grow in large areas, and what do few farmers grow very little. And in the center, you have what get lost. And these are mostly the ones that are very interesting to us. And mostly the ones that are local food plants and are just forgotten. So this is one of the ways of how to create awareness around this and show actually the resources that they have themselves. So yeah, the next picture, please, Chris. Yes, thanks. So this is also one very principal element of the farmer field schools that we work with, is these diversity plots. And this is really where farmers, the members of the farmer field school, gather whatever seeds they have, and then they make it in very tiny plots. It's almost like a demo plot, a showcase, where this allows them also to experiment. Because if you are a farmer in this context, you cannot afford to just throw something out there and see what happens. So actually this gives them the chance to experiment, to try different cultivation methods, and also just crops that they had forgotten about. And then, as a very interesting side effect, actually, is that then hidden almost, but actually very nice for us, people bring seeds home and grow it in their home gardens or in their tiny plots. Because with some, that just it sparks interest and they see the potential of it and they bring it home, and they then see what they can do with it, and actually it ends up in household nutrition. There is the next picture actually that relates to it. So here on the left, we see Margaret, who is one farmer field school member. I mean, I also apologize. Some pictures are not amazing, but they're really all taken by me from field visits that I did. So I met Margaret just a few months ago in Malawi, and she became actually a champion farmer, an agroecology champion farmer. And what that means is that she is growing, instead of, I mean, in the background, we see the maize, and this is copy paste happening in many, many countries, at least in sub-Saharan Africa. That now she's growing millet, sorghum, different peas, and intercropping. And she's the one also showing this to other farmers, and together with the agroecological practices. And why I want to highlight this is also connecting it to a point that Chris mentioned already, really the special role women play in this. And why do we as Oxfam also especially focus on women is, I was also not aware of the extent actually before I started working with Oxfam, that women are really the nexus, because first of all, they do most of the labor in the fields. They are the ones responsible for household nutrition, but at the same time, not in the position of taking having the power to take decisions. So what too often happens is that the man takes the decision, the man is interested in income, hence cash crops are grown, hence household nutrition falls under the table, literally. So that's what I wanted to point out with that picture. And on the right, what we see is also an element that we work with is community seed banks, which I will not talk a lot about, but essentially it works like a bank, so that at harvesting time, you as a farmer, you bring seeds of what you harvested. And then next season, when it's time to plant, you can get not only your own, but also share and exchange with others. So yes, you can go to the next one. And then I already alluded to it, an important, very important element to all of this is traditional knowledge. So knowledge around the seeds, the cultivation of them, but also the use, the consumption and the preparation of it. Because Chris also mentioned already, a lot it is also how those foods are prepared. And unfortunately, the trend is more towards unhealthier ways of cooking and preparing, because traditional ones are much more labor intensive and yeah, Chris already talked about it. So this is also what I want to highlight here, that it's not only the diversity of foods, but also how it is prepared and consumed. Yes, the next one. This is actually the last picture I want to show you. And I connect this picture really with celebrating diversity. And this is also what I want to send you home with. Basically, celebrating diversity of what we have in the fields, but also what we have on the plates. And the emphasis is really celebrating, because what we try to do with our work is also giving back the joy and the self-esteem, essentially. Also the how you perceive what you grow yourself, because then you are also happy to eat it, not just giving it away, forgetting about it, and getting something that's you are brainwashed that it's better than what you grow yourself. So it's a lot about empowering, comes a lot with creating, giving back pride and creating this self-esteem, and then bringing people together. And this is movement building, and movement building empowers, and then you can create system change, essentially. So yes, I want to leave you with this one. Thanks.
Thank you so much, Martina. I'm sorry there was a problem, a technical problem with the presentation. We couldn't see it all. Even I couldn't see it, but your narrative was super good. So you took us to these interesting examples from the field and more grassroots about the School Without Walls and the diversity wheel. Quite interesting. So Gina Kennedy, over to you.
Yes, well, thank you. Well, first of all, thanks so much, Jose Luis and Chris, for this invitation to add some comments to your powerful book. Pun intended. I love Elephant at the Table. It's a very great resource. And in preparing, I just read again, like some of the first words in executive summary, and they're just so important. Food systems will not be transformed unless power is confronted, not as an abstract concept, but as concrete control over land and water, markets and labor, taste, thank you, Chris, and narratives. The stakes could not be higher. Food systems must feed everyone, regenerate ecosystems, and provide decent livelihoods. We're failing on all fronts. This failure is not due to lack of knowledge or productive capacity, but to entrenched power inequities that stem from longstanding historical structures, are actively reinforced by today's policies and incentives, and these drive hunger, malnutrition, ecological collapse, and social injustice. So that's like the opening statement of the report. And again, I just appreciate it so much. So thank you. I will have, I think, nice complimentary remarks to Martina's beautiful place-based, community-led celebration of biodiversity. We do a lot of the same things at the Alliance of Biodiversity and CIAT, Martina, and so it would be great. Maybe we'll have a follow-up meeting. We do seed banks, we do celebrations of biodiversity, food fairs on biodiversity. And so my first remark is and again, these will be, I think, just at a little bit of a different level, sort of maybe connecting with Chris's policies of fiscal reform and equity, that there's this big opportunity that I want everybody to be aware of and hopefully support. It's very much in line with this book, and that is the Biodiversity for Food and Nutrition Initiative. That's part of the Convention on Biological Diversity. So the Convention on Biological Diversity has a conference of parties. It meets every 2 years. And national governments, they're called member states, get together and they work on issues related to use, conservation, preservation of all the world's biodiversity. And so now there's this really specific opportunity that really connects to Chris's chapter to work on biodiversity for food and nutrition. And the decision established by the parties of the Convention on Biological Diversity reflects growing recognition that biodiversity loss is directly contributing to simplified diets, which Chris mentioned, poor nutrition, reduced resilience of food systems globally. So what's interesting is that this needs to not just be words on paper. So we have an opportunity in the upcoming conference of parties on biodiversity to give more life to this. And so the Alliance of Biodiversity and CIAD are working on this together with some others, most notably Food and Agriculture Organization, who has a big stake in making sure this initiative, and it's also very nice, right? Because it's cross-cutting. So that doesn't come like from nutrition community or from dietetics community or even from food systems. This is like the biodiversity community saying, hey, guys, food and nutrition is really important.
Gina, you are muted.
The whole time.
No, just now.
Just now. Sorry. And my cat's not even up here pushing the buttons. I don't know, that was me. So we had a nice reflection yesterday internally at the Alliance on the Eat Lancet, and my colleague, Dr. Ramya Ambikapathy, was part of the Eat Lancet Commission, and she worked specifically on the justice, which was kind of a new framework and a new dimension brought into Eat Lancet. And it just, when she spoke about food justice, for me, it was like, oh, such a great intersection with this chapter. And they have a very nice framework that talks about recognitional justice, whose identities, values, cultures, and experiences are acknowledged, representational justice, who has a voice in the decision-making process, and distributional justice, who gets what, how fairly, and how are resources, risks, and benefits shared. And then Ramya went on to advocate for a fourth arm in this justice framework, which is restorative justice, which, Chris, you also just spoke about. It asked that past harms be needed to be acknowledged and repaired before trust is even possible. So I think that's a very nice framework that I think that there's more iterations of the book. So I wanted to also mention that. I have 2 more points. One is on the food-based dietary guidelines. I agree that it's a very good solution. In addition to the beautiful example of Brazil, there's also a beautiful example from Colombia, where they have really celebrated the biodiversity that can be produced in Colombia. And then there's also a beautiful example of an indigenous people's food-based dietary guidelines for Canada. So there are some additional examples, I think, that are powerful that we can speak about. And then there's also the not so positive examples Chris also alluded to. So I think just to make sure, it's nice to say, oh, everybody's voice and this needs to be a science-based process. But I do think we have to recognize that not all governments are ready for food-based dietary guidelines to be a science-based process. And so maybe just a little bit more and in that case, so then what do you do? So I know in the case of the United States, a lot of dietitians and public health nutrition specialists have been open about what they feel are the weaknesses, but it's clear that there was a lot of lobbying and a huge elephant around the table when those were being written. So I think that just kind of also needs to be acknowledged. And then the last thing I want to talk about is measurement. So we didn't really talk so much about measurement, but Chris did point out, and Martina did point out, if you look at global statistics, rice, wheat, maize are kind of dominant. And then if you go into local communities and study with them, what what do you still grow? Maybe some farmers only grow a little bit of it. And we also use that 4-cell approach a lot, 5-cell approach with the center cell being what no longer is available. But so we have this opportunity to be much more granular, even for us as nutritionists and dietitians, in how we measure what people are eating. And so I just want to end with, we need to be much more granular and look at species level, even what's being produced, like Martina showed, that was really beautiful, and what could be available in a seed bank, and linking that also to dietary intakes so that we get a much more rich, robust, true picture of what people are actually eating. So we need to work on some tools that go beyond the food group approach and actually can tell us about species. And one indicator that I'm particularly excited about is the dietary species richness indicator. And that just counts the number of species that a person consumed in the day or whatever the reference recall period is. So I just want to highlight a couple of different ideas maybe, but like mainly congratulate the group of writers for the book and especially Chris for his chapter because it's very important work. So thanks a lot.
Thank you so much, Gina. It's very interesting to hear a global expert from a major international organization talking about the importance of including a justice approach on nutrition, diets, and power is very inspiring. So thank you very much, and thank you also for your remarks on the report. And thank you all for sharing such powerful insights and knowledge. Now we are moving to the Q&A section. So I'm going to go to the chat box and start with the first one, and is probably directed to any, but maybe Chris. Are high yield varieties lowering nutrients than similar lower yield varieties? And that's very important. No, when we talk about how the system is producing cheap calories. Do you want to take this one, Chris?
Yeah, sure. I'll start, and maybe Martina and Gina want to hop in as well. But yes, the answer is traditionally that is the case with high yield varieties. The focus is really on maximizing growth, full stop. And so when you're doing that, you're missing out the micronutrients, the flavor. So the thousands of bioactive compounds that are in food that give it the taste and flavor and smell. We're just now beginning to understand the breadth of the value of those bioactive components. There are many we still don't understand, but we do know that they're generally very good for us. And when you lose that taste and smell, and you're actually losing those bioactive compounds as well. And so just think of it as like a tomato you get in the grocery store off season that tastes like nothing and smells like nothing versus like a local tomato that is a more heirloom variety that is bursting full of flavor. That is really meaningful differences in nutrition as well. And maybe it might not register as vitamin C content, but it would register under lycopene and other bioactive compounds. So it really does depend on how you're growing it and what seeds and varieties you are using to grow it, and that does impact the nutrition significantly. Gina and Martina, do you guys have any thoughts?
I think that was a perfect answer, Chris. And I guess just to add one small point onto it, yeah, there could be some significant differences in say, and something that we are studying a lot, what are the differences in maize grown under different agroecological conditions or some other those big staple crops. But also I would just always advocate, like Chris did, he brought up an example of tomato, to like take us out of staple crop mentality and what are we losing in our staple crops, and it's going to be such a tragedy because as Martina showed us, there's actually legumes, nuts, seeds, fruits, green leafy vegetables, aquatic foods, all manner of different biodiverse foods that can also support meeting nutrient requirements. So rather than like, oh, what are we going to lose in rice and maize? Actually, okay, you can spend a lot of time talking about that, but let's actually talk about what can you gain by actually adding more biodiversity into the diet? Because I think that's just a obvious pathway.
Thank you. Thank you so much. There's a question more related to the 2026 US Farm Bill about the current subsidies. I'll make it broader so any of you can answer it. And it's about how the subsidies are biased right now with like supporting cheap commodities or cheap calories, and how we might be able to move to repurpose those subsidies for healthy products. No? So is it about empowerment of the groups that are more aligned with the subsidies for healthy products? It's about changing the narratives. It's about generating more evidence. It's about reducing corporate control. I'm giving you many options, but I would love to hear the insights from the three of you, actually, if you like.
Gina, Martina, do you want to start, or I'm happy to?
I can start, Chris, and then maybe
Yeah.
you can jump in because I know you do quite some research also in the United States. But yeah, this issue has been talked about for a really long time. You know, the entrenched subsidies in United States food system as well as European food systems. Um, and and it does take a long time to move the needle. I'm not sure. It's not also not my area really. So other than kind of following up, maybe with some more granularity and also tracking change in a European country or in the United States, as Chris suggested, diverting a bit of the subsidy money, even if it's a fraction, to actually fruits and vegetables or anything beyond those staple commodities. And we know that lobbyists are, you know, lobbying in the United States is a full-time business, a full-time occupation for a lot of people, and those lobbies are strong and they're political, and that's what your whole book is about, right? Um, and I guess the other thing, like to be slightly more positive about the U.S. food-based dietary guidelines, the new version, is that they really do come out pretty strongly against ultra-processed foods. And if you're going to come out strongly against ultra-processed foods, then that sort of by nature is going to, it should like tilt toward producing, you know, they talk about more whole foods and et cetera, like things like that. So, I mean, I guess it's not really a great answer, but it's a space to watch. And maybe hope, you know, with hope springs eternal. Some of the food-based dietary guidelines could move the needle towards decreasing subsidies that just go straight into ultra-processed foods. But we'll see. Chris?
Yeah, thanks, Gina. That's a perfect answer. To comment specifically on the updated Farm Bill, I have not read it in its entirety, but it's my understanding there was a slight increase of subsidies for fruits and vegetables, but at the end of the day, it's still a rounding error for the subsidies that are given to commodity crops. It's not a meaningful difference. And so I do also find it interesting, Gina, that the updated dietary guidelines do focus more on whole foods, less processed foods. But I'm struggling to see the connection to the policy actually being enacted to promote more of those foods from the subsidy level. It seems like there's a misalignment between what they're saying that we should be doing and what we're actually putting our dollars behind. And so I hope when your eternal hope spring, well of eternal hope, I hope that we can get there. But right now, it doesn't seem like there's alignment between the EPA, agrochemistry, or agrochemical industry. They seem to be releasing more and stronger agrochemicals here in the US and rolling back regulations while at the same time saying we need to reduce pesticides in our food. So it's a conflicting message. And I hope that there's some resolution towards a more equitable, affordable, and biodiverse food system, but that is yet to be seen. Thanks.
Maybe if I can just add a small thing in terms of curiosities of subsidy flows in the global south. Unfortunately, it's also that these go to a large extent to the big global players of seed production and agrochemicals. And in addition, in fact, actually also the emergency relief aid often goes in that direction. So that then in the end, what farmers get is hybrid seeds and a full package together with all the agrochemicals that you need or that you're supposed to use, and then you're already in the trap. And this is also, studies have been done. Oxfam also did in several African countries to really try to track these subsidy flows. And also, like Gina mentioned already, some governments are really not ready, and some governments do not have nourishment of their own people as the highest priority at all.
Yes, thank you all. It's like quite interesting, no? The current subsidy structure in most countries in the world reflect the power inequities that we talk about in the report. So without addressing those power inequities, we can have the evidence by our sides, like the technical arguments, but in the end, it's a matter about political priorities. So it's the big question is how can we influence those political priorities so they address nutrition and they address the environment, and in the end, the access to affordable, healthy diets. We have other questions in the chat, so I'll move to the next one. How should we approach affordable and healthy diets in rural versus urban settings in a different way?
A great question. Martina, do you want to kick us off if you have thoughts? If not, I'm happy to.
Yeah, I can talk a bit more about the rural setting. I think what we try to do, and what might be different or is actually different to the urban setting, is to keep it local so that farmers do not produce just to sell. And then, I mean, we know the issue, then use their income to buy as cheap food as possible, but actually eat it themselves, and also the diversity they produce also to eat it themselves. So that's exactly also the link that we were talking about. If you try to trace diversity in the field, where does that land land? Does it actually go onto the plate? So to keep it as local as possible with local markets, and the community seed banks, like really this setting, that I think in the rural setting is one of the most important things. Urban is then a different story, so maybe someone else can talk about this one.
Yeah, thanks. Happy to jump in, and thanks for that explanation on rural challenges. Yeah, I think the urban intervention and struggles, challenges are quite different than rural. I think given that urban affordability is often shaped by retail concentration or food deserts, or even kind of ensuring that local communities have the access. I think the urban interventions lean more towards ensuring retail regulation, procurement, social protection, school feeding, those sort of options, ensuring that the local food environments are and do and can provide affordable, healthy options. As I mentioned and alluded to, the supermarket concentration in many LMICs in urban settings are pushing out those informal vendors, which are a critical component to a sustainable food system. These small scale vendors selling local fruits and vegetables versus a large box store coming in and homogenizing the offerings. And it's kind of a cultural homogenization in a way. So how do we really ensure that in urban settings that there are ways to access and build food environments and ways to access these more local, affordable foods without middlemen, grocery box stores coming in and kind of absorbing many of those profits, especially since many of those stores are multinational corporations, and oftentimes those profits leave the country or the communities in which they're made. So keeping the dollars within the community is one great way to ensure that farmers are paid well and costs are kept low. I'll pass it to Gina if she has any questions. If not, we can move to the next one. Thanks.
Thank you. It's quite interesting. Also, the report, The Elephant at the Table, emphasizes in urban settings, but also in rural, how certain traditional and informal supply chains should be strengthened because they have this potential of making healthy products and more biodiversity available to everyone, but they have been neglected for decades. Actually, the next webinar session on April 22 is going to cover those informal, traditional, and public systems that are usually neglected when we talk about supply chains and how the narrative is always focused on the modernization of the supply chains instead of the more industrial. So I think that we have only 2 or 3 minutes left. So I'm going to start closing the webinar. But first of all, I wanted to tell you about a document that is coming up for consultation from the high-level panel of experts on food security and nutrition. I'm a member of the steering committee, where we have released earlier in the month a document called the Critical, Enduring, and Emerging Issues. These are the issues that should be higher up on the agenda for the next years, and probably they are not there yet in the food systems and food security and nutrition debate. Why am I mentioning this here? Is because one of the topics that we identified as a priority is the affordability of healthy diets. Actually, what we touched upon this in this webinar with these very important insights from the audience and from the panelists. So please, the open consultation in this document and in this process is taken seriously. So take the time. I'm going to paste it on the chat, but I'm also going to post it later on LinkedIn. So please check the document. It's just like a collection of different briefs. One of those is on affordable healthy diets, but there are many other topics that are very interesting. But please, we need your comments. We need your feedback to make the document stronger, because this document informs what this high-level panel of experts is going to promote in the next few years. So ending with that is a topic that is related. Thank you very much for sharing these powerful insights and knowledge. Thank you, Chris, Martina, and Gina for today's session, and all of us for joining, all of you for joining. A brief reminder that the policy brief is available for download. We have pasted the elephant at the table report there in the chat box, and the recording and the slides will be shared after the event. Our next session, like I mentioned, is going to be next week, next Wednesday, April 22nd, and is on food supply chains and power also with a very interesting panelists. So thank you so much, and I hope that we'll see you next week.